neighborhoods of East Austin. Beyond the cross-through streets, behind broken-down homes, some afraid to speak up or even ask questions. Health is just one of the struggles for families living here. This is Dee's story. It all begins inside an exam room at People's Community Clinic in Austin.
Well, we serve really working families. It's a heavily Hispanic population, so we are really focused on a population that is very much underserved, kind of falls through the cracks.
Dee's family fit that description. Her parents brought her to the clinic because the little 17-month-old was covered with mosquito bites.
The physician had actually seen the toddler and then other siblings several times for these mysterious bites. And this particular pediatrician began asking some question, what's going on that you're getting all of these bites?
Asking that one simple question started a process of finding out the true cause of the bites. And turns out the reason wasn't as simple as you may think. Dee's family was living in a rundown apartment with a broken air conditioner, and when they opened the windows to help break the heat, they had no screens to keep the bugs out.
There was also a carpet that had been removed, and so this family has a bare concrete floor. This family was very typical in that there were actually a number of issues going on, a number of conditions with the housing that were worsening their health.
Keegan Warren Clem isn't a doctor. She's an attorney with the Austin Medical Legal Partnership. It's a nonprofit group that stations lawyers inside People's Community Clinic, a joint effort to work with patients' legal issues like housing or employment that are directly affecting their health.
No amount of creams or steroids or anything else we're going to remedy the health issue, and her treatment wasn't going to be effective until we took care of the root cause.
So after doctors treated Dee's mosquito bites at the clinic, Keegan and her team went to work, pushing the landlord to fix the AC and put in carpet, things the family did not demand because they felt they couldn't.
Because the family did not have documents, their immigration status was not clear, they were reluctant to ask for anything.
Out of fear that the landlord will say, well, fine, you can't live here, I'm going to call ICE.
After demand letters, the landlord finally fixed the air conditioner. Eventually, he allowed Dee's family to break their apartment lease. They soon found a better, healthier place to live.
In the end, the medical condition that started all of this was also remedied, and that's really where we're seeking to be.
Dee's case shows how a clinic's commitment to address root causes of health problems goes far beyond medical treatment in an exam room. It's an approach centered on collaboration and partnerships, part of a connected community. An approach supported by the Episcopal Health Foundation and its vision to transform community health.
What we know today is that health and health status are influenced by a lot of factors that are way outside of the healthcare delivery system. And if we really want to get at root causes and we want to do more than just treat the symptoms, then we have to move to a different model of philanthropy.
A foundation that recognizes that there are costs associated with being able to go beyond the walls of the clinic, that's an incredible, incredible gift to a clinic like ours.
It doesn't really matter what the condition is. Either way, if we're repeatedly using healthcare resources, which are very limited, to treat the same thing over and over, then we have a problem.
We are the Episcopal Health Foundation. Health is our life story.